Hello everyone, today I'm going to be talking to you about Medicare for All and why you should vote for Medicare for All. I'm going to be debating three arguments. The first one I'm going to talk about is how Medicare for All will create equal opportunity for everyone in this country, all American citizens. Second, I'm going to talk how Medicare for All will lower the healthcare costs overall. And lastly, how it will help both medical care providers as well as patients. To start off with, Medicare for All will give everyone an equal opportunity to insurance. Millions of Americans have a low income or they're homeless and cannot afford to pay private insurance for themselves, let alone their families. According to ABC News in 2008, they mentioned that 1 in 5 Americans, that's 20% of Americans, cannot afford or they have zero access to health care. And ever since then, this number has only increased. Medicare would not only provide the health care to these people, but to every citizen, and no one would have to pay an out-of-pocket expense. It would cover the whole spectrum of care. Think about it. Oral, vision, eye care, primary doctor, all care would be covered. The reason that this matters so much is because these people with low income or homeless people, they suffer more. Someone who has a full chance to live, who are healthy, but they need some kind of providing of Medicare, some kind of doctor, whether it's oral or vision or something they need to get checked, they will only get more sick and possibly die just because of a lack of coverage. And if they had this coverage and if they had these opportunities that could be fixed within a day or a couple weeks, they could literally save their lives. So to not have Medicare for All is honestly unethical. Now that I talked to you about Medicare giving everyone an equal opportunity, I want to move on to my next argument, which is how Medicare would lower the costs overall and benefit the government, the citizens, but also the workplace, companies and businesses. Medicare for All is a cost-effective healthcare plan. America has the highest health spending in the world. According to JAMA, which is the Journal of the American Medical Association, in 2016, not just millions or billions, but trillions are being spent on U.S. healthcare. The health spending in the U.S. has totaled to $3.3 trillion in 2016. By expanding Medicare, it would lower the health spending for businesses as well as how much goes to the government. Many employers pay a ton for insurance, and I see it with people I know, companies I'm involved with my family. They pay so much for other employees to have insurance. So many employers pay a ton for their employees, and employees think that this is a benefit for them, but really it just means that by receiving this insurance, they're just lowering their salaries, lowering their potential raises, lowering potential other benefits. So if employers did not have to pay such a high price, employees could end up having a higher salary, so they would end up with both insurance coverage and they would have higher salaries, higher benefits, higher raises. Now that I talked to you about how Medicare lowers overall healthcare costs and how it would benefit people in the government, in the citizens, and in the workforce, I would finally like to make my last argument about how Medicare will lower the complexity of the current healthcare system. We have an inefficient healthcare system, and creating Medicare would just make it finally efficient. Medical workers on a daily basis have to work with multiple different insurance companies. There are multiple private insurance companies, and everyone has their own rules, has their own ways of going about how they deal with doctors and patients. So if the patient and the doctors or the hospitals would switch to one coverage, to Medicare, it will save time, it will save a huge headache for the doctor, the staff that has to deal with them, the patients, all of the above. It would help everyone. In 2019, Medicare for All, Sarah Fisher says, doctors would only have to deal with one government agency rather than multiple private insurance companies. Also, emergency rooms will become less cluttered. People in true emergencies will have an easier time in the ER because many others will have the option to go and see a normal doctor instead of an ER physician. According to Smart Asset in 2020, it says that by having a universal healthcare, almost half of the emergency room patients were there because they had nowhere else to go. The emergency room became their primary care physician. This type of healthcare inequality is a major factor in the rising cost of medical care, and by expanding Medicare, it will literally save mass amounts of life.